What are the common mistakes a learner of Roga Nidana will be doing? How to identify those mistakes and how to correct them? These are the contents of this particular video. Here we are going to learn about the 10 common mistakes a learner of Roga Nidana, or what we can say any subject, can be considered in this particular video. The common mistakes done by Roga Nidana learner are not getting enough sleep, skipping the breakfast, only reading their notes for revision, studying without a plan, just reading but not learning, studying without interleaving, studying without associations, studying without pictures, avoiding difficult subjects, not becoming a part of a community of learning. These are the common mistakes, 10 mistakes that will be done by a Roga Nidana learner. Of course, these are the mistakes that can be attributable to any other subject, not only in terms of the Ayurveda, any other subjects in terms of the either technology or medicine or the STEMs, etc. STEM subjects we can able to apply. Now we are going to learn each of these one by one in a little bit elaborate way. Not getting enough sleep. A learner, specifically who is attaining the 14 to 18 years as such, they are needing up to 7 to 9 hours of sleep as such. Of course, the timing of the sleep is also very, very essential. Nowadays, the present trend is they are going to do the night outs for the study and they are going to sleep in daytime, so that will be disturbing the whole physiological process itself. When you think about the normal sleeping, ideally he has to go for the 10 o'clock or so, then he has to wake up at 5 o'clock or 5:30. That will be the ideal time for getting the sleep as such, which will be helpful in growth of the body also. Instead, the persons are sleeping at around 1 o'clock or 2 o'clock early morning, whereas they are going to get up at 8 o'clock in the morning as such. In that particular situation, definitely, so that will be disturbing the whole sleep cycle itself, wherein whole physiological aspects such as the attending the nature's call, everything, etc., or getting the breakfast, etc., that will be going to get disturbed, which in turn results in the whole disturbances in the other body systems itself. So that will have an impact even on the studying also. Whenever if the person is not getting enough sleep, if they are going to the classes, etc., so that will be leading to the burning sensation in the eyes, or that may lead to sleepiness in the classroom also. In that way, the learning may be affected in this particular way. When you think about the skipping the breakfast, a recent study it was being conducted, which is saying nearly around 63% students are skipping the breakfast. When you think about the skipping the breakfast in the sense, naturally, so that will be responsible for the supplementation of the carbohydrate, specifically glucose, etc., which is one of the essential nutrient required by the nervous system. When the person is skipping the breakfast, so that will be responsible for the devoid of the glucose in the body, which in turn leads to the fat metabolism. Thereby, ketoacidosis may be developed. In that way, lack of glucose may be occurring, for the brain, which in turn leads to lack of concentration or lack of grasping the knowledge that will be disturbed. In that way, this is another major mistake the students nowadays are doing. Next thing regarding the rereading the notes for revision. So the students are making the notes in their classroom. When you think about the classes as such, the teachers who are coming to the classes or they are going to do the skimming of all those different textbooks. They are going to deliver the lectures in the classroom. So that means if you are going to consider the 100% of their teaching, they are going to give the information up to 10% only. So the variation of the grasping capacity of the students. So if you are looking into that 10% of the knowledge, if you are taking the notes as such, so that will be considered to be the students, they are going to take only up to 10% of the whole lecture itself. When you think about that, and when you reading that particular 10% of the notes, so that will be coming only 1% of the information will be grasped by the students as such. So that means when you think about the 100% of the information given by the teachers in the classroom, only 10% of that will be taken up by the students as notes. And when you start reading those notes, even though you're going to have the only 1% of the information itself. That's how the rereading the notes for revision may be another major mistake. Instead, what you can do, that means you have to go for the other books as such, so that add the information to that particular note, so that the information on that particular notes as such that will be getting enhanced several times, so that you can have the maximum information available with you. In that way, rereading the notes for revision may be another major mistake as students are doing. The next major mistake is studying without a plan. Plan in the sense that is considered to be a strategy. Strategy in the sense that is a step-by-step process to have the proper learning of a subject. Why so this studying without a plan is happening now? Because the actual why to study a particular subject is not clear. This particular the improper clarity makes the students to have the confusion on the subject. This is equally true in case of the subject of Roga Nidana also. The students will be having the difficulty where to begin. Whether is it from the dosha, or whether is it from the dushya, or whether is it from the srotas, or whether is it from the agni, or whether is it from the ama, or whether is it from the vyadhi, or whether is it from the pariksha, or whether is it from the roga marga, or whether you have to concentrate on the fundamentals of Roga Nidana, or whether you have to concentrate on the individual diseases as such. So like that, so where to begin? Because of the vastness of the subject, students are not in a position to give the exact point as such where one can start their learning. That's why, so this is a clarity that has to be essential, but that is not there in the present day as such. When to begin? The timing of the studying, whether is it in the morning or evening, or whether is it at the beginning of the professional year, or whether is it essential to have at the examination time. So when to begin? How to associate with the subjects of first year and third year? First year is having the Samhita Siddhanta, Sharira Rachana, Sharira Kriya, Samskrita, how to apply them in Roga Nidana. In the third year, we are having Kaya Chikitsa, Shalya Tantra, Shalakya Tantra, Prasuti Tantra Stri Roga, Kaumara Bhritya, and research methodology and Panchakarma. How to relate the Roga Nidana with that third year subjects. In the second year, the second professional year, the other subjects are Dravya Guna, Shastra Vaishishya Kalpana, Swastha Vritta, Agata Tantra, and Samhita Siddhanta. How to relate the Roga Nidana subject to all these subjects, that is one of the major lacunae present day students are having. How to associate it, that has to be planned. Then only they can able to have the lifelong learning as such for long-term memory. Then the students are having the difficulty in deciding the first topic to be learned in Roga Nidana. Whether is it dosha, or whether is it pariksha, vyadhi, or whether is it nidana, which nidana one has to study first, that is considered to be major difficulty there. And what should be the step-by-step plan can be done for the study of Roga Nidana. This is considered to be a very big confusion. That is, which topic should be preferred first. That's why the students are having the difficulty in learning the subject as such, because they are not having the proper plan itself. And another major mistake, that is, they are going to do simply reading, but they are not doing the learning. For example, here there is a one particular Roga Marga understanding is there. It is being mentioned that Roga Marga is a Sanskrit word, comprises of two words, Roga and Marga. Roga is considered to be any kind of the discomfort caused by abnormal vitiation of the dosha, whereas Marga refers to the manner in or direction of a movement of the particular dosha as such. This is considered to be the subject of Roga Marga as such topic. What the students will do, they are simply reading that particular word itself, but they are not going to learn that particular subject. So there is a huge difference between reading and learning. Reading in the sense simply reading that, just like reading the novel as such, whereas learning refers to you are going to ask the questions in yourself. What actually Roga Marga is. So, what is the significance of Roga Marga in the present day? How to understand Roga Marga, how to understand Bahya Roga Marga, how to understand Madhyama Roga Marga, how to understand Abhyantara Roga Marga. What is the extent of Bahya Roga Marga? When do you say the person is suffering from the Bahya Roga Marga Javikara? Whether the person is having the affliction of the blood, can we say the Bahya Roga Marga affliction? Or the person is having the joint pain, can we say the Bahya Roga Marga affliction or Madhyama Roga Marga affliction? How to identify that? What is the relation between Abhyantara Roga Marga and Adhyashana? So, Abhyantara Roga Marga, most of the occasions it is being said to be the alimentary canal as Abhyantara Roga Marga or Koshtha. What is its relation with Adhyashana? How Adhyashana will lead to abnormal functioning of Abhyantara Roga Marga? So that has to be asked. Then only the students can be able to learn that particular subject well. How to connect Abhyantara Roga Marga, Bahya Roga Marga and Madhyama Roga Marga? How we are going to say pathogens which are present in the alimentary canal that will move into the intravascular compartment or interstitial compartment or intracellular compartment of the muscular tissue, of the bone tissue, of the bone marrow as such, of the adipose tissue. In that way, how to connect these, that has to be only by asking the questions only they can able to learn it. What is the relation between the Nidana and Roga Marga? Whether the person is having the exposure into the nose, will that lead to Abhyantara Roga Marga affliction? or the person who is having the exposure of this particular pathogen in the eyes, will that lead to abhyantara roga marga affliction? So in that way, that has to be uh, they learned by asking the proper questions itself. Or how to identify this adhyasadat of a disease, or what we can say the prognosis of the disease based on the roga marga, that has to be analyzed. Only whenever if you are asking these particular questions, then only the proper learning will be happening. So that's why reading is different and learning is different. Reading is simply reading the subject like the novel, whereas learning is reading that plus applying that the information by asking the questions repeatedly in yourself. That's how most of the students are just reading that, but they are not doing the learning as such. That's why try to develop the habit of asking the questions for yourself or for your teachers. Then only we can have the proper learning. Then studying without interleaving. This is the next mistake the students are doing. Studying in the sense that is doing the learning as such. Whereas interleaving in the sense, the term interleaving in the sense, we are going to leave the subject for a particular time period. For example, we have studied the point of Roga Marga for a period of 15 or 20 minutes. Then, after a matter of 5 minutes later, we are going to learn the point of physiology, and we are going to try to link that particular physiology to the Roga Marga. That's how interleaving, that means leaving that particular subject for the particular time being, we are going to learn the new information as such. That is what we can say, linking the subject, known subject to the unknown subject as such. Then we are going to, after a matter of later, another 5 or 10 minutes, we are going to apply the principles of pathology in terms of Roga Marga. Then we are going to apply the principles of medicine in terms of the Roga Marga. Plus, we are going to apply physics, chemistry, and biology and its interpretation in terms of Roga Marga. So, all these are possible if we are applying the principles of interleaving. Interleaving refers to we are going to avoid this particular subject for a particular time period, for 5 or 10 minutes or half an hour as such. Then we are going to learn the totally a new topic, and you are going to apply that particular topic towards the Roga Marga as such. That's how this is the another major mistake our students are doing. That's why the difficulty is increasing nowadays in learning the subject of Roga Nidana. The next major point, that is studying without associations. We are going to study that for example, here Indriyani samashritya prakupyanti yadamala upagata upatapabhyam yojayanti indriyani te. This is the context of Indriya Pradoshaja Vikara. What the students will do, they are simply by hearting this particular shloka, but they are not going to apply this particular shloka to the real life case scenario. For example, so here Upaghata and Upatapa, they are not going to apply in terms of the Padartha Vijnana or Samhita Siddhanta. They are not going to apply in terms of the real life application in terms of the Roga Nidana. They are not going to apply in terms of the OPD setting and IPD setting in the hospital. For example, so here it is the image of the hand is there. It's a patient of a claw hand deformity, which is specifically seen in motor neuron diseases. Whenever if you think about this particular clinical presentation, Indriya Pradoshaja Vikara, specifically it could be Upatapa initially. If the person is having the severe form of this particular difficulty, it may move towards Upaghata also. So that's how the Hasta Indriya will be afflicted here. So here the application of this in terms of the real life case scenarios, so we can able to apply principle of Indriya Pradoshaja Vikara. That's how this is one of the major mistakes students are doing. They are not going to associate the whatever they are going to learn with the real life case scenarios. That's why they are facing the difficulty. Another major issue with the students nowadays is studying without the pictures as such. Most of the topics, whenever if you look into that, they are unimaginable. The students are not doing the actual visualization, what actually so that particular information refers to. For example, so here it's an image of human body in terms of Roga Marga. Whenever a person is presented with chest pain, he may be having the right knee joint pain and he may be having the right skin of the foreleg that is being afflicted. In that particular situation, the pathogens are moving in the chest from the intravascular compartment. A different set of pathogens are moving in the right knee from the intravascular compartment. Third set of the pathogens are moving into the right skin from the intravascular compartment. That's how proper visualization is not being followed by the students. That's why they are facing the difficulty in learning the subject as such. So, how to identify the affliction of the chest as such? The person may be having the cough, the person may be having the chest pain, the person may be having the breathlessness, or the person may be having the burning sensation, etc. In that particular way, we can able to learn that the person may be having the chest affliction. Whenever if you think about the right knee joint affliction, the person may be having the right knee joint pain, the person may be having the right knee joint swelling, or there may be a possibility of the redness as such that may be observed, which may suggest that the person may be having the affliction of a right knee. Whenever if you think about the right skin as such, there may be a possibility of itching, there may be a possibility of redness of the skin, or there may be a possibility of ulcer formation, etc., wherein we can able to learn that right skin of the foreleg may be afflicted. In that way, we can able to visualize the pathogenesis, pathological events in terms of the Roga Marga understanding. In that way, the studying with pictures may help a lot rather than studying without the pictures as such. Avoiding the difficult subjects is the next major issue students are facing now. Avoiding the difficult subjects. For example, Avarana is one such particular subject, very difficult concept to understand. So nowadays, the major as what you say that the pattern of studying is if you are having the difficult subject, leave it. That is the most common the pattern of the studying is followed nowadays. That is Avarana is one particular topic which is considered very, very difficult. Understanding of Arishta. How to know about the Arishta. How to diagnose Arishta. That is the difficult aspect that we can be faced by the students. Nidhanarthakara Roga. Another major topic or concept of Raja Yakshma. Or how to understand Janapadodvamsa. How to know about the Vikrita Jala, Vikrita Desha, Vikrita Kala, or Vikrita Vayu, etc. So that is the students are nowadays avoiding that if they are finding the subject as difficult ones. That's why learning is becoming difficult nowadays. Last point is not becoming a part of a community. So, community in the sense the group of the people having the same kind of the vision as such, or same kind of the mentality as such, or the same kind of the what do you say that the moving forwards nature as such. Nowadays, students are becoming alone. If they are facing the difficulty, they would like to face the difficulty by themselves, and they would like to find the solution by themselves, and they are not going to consult the others or consult their elders or consult the more experienced people who are on that particular subject. So that's why the students are facing the difficulty, because from the A to Z, everything they have to do by themselves. Whereas whenever if you go for the community learning as such, they are having the path that will be decided by the already the members who are present in that particular community, who have traveled a particular distance already. That means they are having this set pattern so that they can able to learn the subject faster. So to sum up, these are the 10 major mistakes students are facing, that is not having enough sleep and skipping the breakfast, only rereading their notes for revision, studying without a plan. They are going to do just reading, but they are not going to learn the subject as such. Studying without interleaving, studying without associations, studying without pictures or visualization, or avoiding the subject as such and not becoming a part of community of learning. These are the 10 common mistakes a learner of Roga Nidana is doing. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners. Dear ANA community, put a thumbs up so that you can get the right information at the right time for the right purpose, so that the YouTube are getting that right algorithm for your right learning. That's all for today. Something more in the next video. Thank you.